Hi, my name is Emer Honan and I'm one of the nurses working here in St. Francis Hospice, and I'm going to speak a little bit about some of the risk factors involved with falls for Falls Prevention Week. We know that lots of falls can be prevented, but there are some risk factors that we know we can mitigate against. They will be things like being aware of any changes in how you're feeling. So if people begin to feel dizzy or unsteady, it's definitely worth speaking to your GP about that. It may relate to things like medication changes or your blood pressure, and can be resolved with some guidance. Other areas of concern might be around needing to use the bathroom more frequently, or having to rush to the bathroom, or getting up at night to use the bathroom. These would all be times when people might be more susceptible to having a fall, and it's worth chatting to your GP if this is something new for you or something you're finding more difficult to manage at home. Some other areas that might be relevant can be around people's eyesight. So if people notice changes in their eyesight, it's more difficult to see, particularly in darkened areas. Practical things like keeping lighting appropriate are really helpful, but if it's a change for you, if something's different, or if you wear glasses and you feel they're not working the same way as normal, it's definitely worth having your eyes checked out. People also talk about footwear. Some falls are caused by ill-fitting footwear, or things slipping off, or people's feet slipping on the floor. So one of the pieces of advice we'd be keen for people to remember is to make sure that their shoes are comfortable and are well-fitting, and that they're secure, that they're not going to move when you're walking. We've lots of patients and families who wear gripper socks with a gripping sole when they're in bed at night, so that they do need to hop out of bed to use the bathroom, that they're not going to slip on the floor. So just some practical things that are easily sorted out, but that can really help reduce the risk of falls at home or wherever you might be. So always come back to your GP or to another healthcare professional if you notice some changes around those areas.